training. Epilepsy is a disorder of the brain and sometimes caused by abnormal chemistry. Sometimes the cause is unknown. A child's brain contains millions of nerve cells. They communicate with each other through tiny electrical charges that fire on and off in random fashion. When some or all of these cells suddenly begin to fire together, a wave of electrical energy sweeps through the brain, causing a seizure. 50% of all cases begin before the age of 25. Seizures. Seizures are the result of abnormal or excessive electrical activity in the cerebral cortex. Underlying causes can include hypoxic damage to brain tissue, a tumor, traumatic brain injury, metabolic disorders, infection, genetic malformations, or no known cause. Two classifications of seizures, partial and generalized, and they both have their subclasses. While absence seizures are only brief, lasting seconds, they affect the whole brain, are classified under generalized seizures. There is nothing that needs to be done generally for absence seizure except reorient the student to anything he or she missed. If you note that the student is having numerous absence seizures in a day, call the school nurse. Partial seizures have foci in only part of the brain. Generalized affect the whole brain. Tonic is stiffening, clonic is jerking and shaking. Atonic is going suddenly limp, as in a drop seizure. Children with drop seizures may wear helmets to protect their head during a fall. Tonic-clonic are generalized or grand mal seizures many people have witnessed. Here's some information on partial seizures and their subclasses, such as simple partial, complex partial, focal. As previously stated, generalized seizures involve the entire brain. Generalized tonic-clonic affects the entire body. Falls and becomes unconscious. Body stiffens, muscles alternate periods of spasm and relaxation with jerky motions, may have loss of urine or stool, and lasts about 1 to 3 minutes. Absence seizures cause brief loss in awareness, 1 to 10 seconds, during which there may be staring, eye blinking, or mild facial twitching, usually maintains posture and does not fall, often stop before adulthood, but sometimes changed into generalized tonic-clonic seizures. Status epilepticus is most convulsive seizures are self-limiting and resolve in 2 to 3 minutes, but status epilepticus is defined as a seizure that persists or is repeated frequently enough that recovery between attacks does not occur. A persistent seizure is one that lasts longer than 5 to 10 minutes. If status epilepticus is left unchecked, it can cause lasting effects on the brain. Seizures can cause changes in behavior, movement, or sensation. Seizure management consists of medication, ketogenic diet, a vagus nerve stimulator, or epilepsy surgery, or a combination of those listed. Triggers can be illness, sleep deprivation, noncompliance with medication, menses, bright and or flashing lights, fatigue. Basic first aid. Place a cushion under their head. Remove glasses, loosen tight clothing, turn on side and keep airway clear. Note the time a seizure starts and the length it lasts. Do not put anything in a student's mouth. Do not restrain. Emergency action plan. If a student has a VNS, follow guidelines. If a student has diastat orders, follow their doctor's guidelines. Otherwise, always stay calm and dismiss bystanders. Notify school office by phone or sending one person. Notify parents or delegate this. Protect the student from injury. Do not restrain the student. Seizing must run its course. Remove eyeglasses, loosen clothing around neck, turn student on side to allow saliva to drain from mouth. Do not put anything between mouth or teeth. Observe pattern of seizure and be prepared to describe it on the seizure log. When the seizure is over and the student regains consciousness, assist them to the nurse's office. Allow the student to rest. Reassure student and classmates. Call 911 if seizure lasts more than 5 minutes or if more seizures should occur or if this is their first seizure. When to call 911. A first seizure in anyone who's never had one before. A seizure lasting 5 or more minutes. Refer to their care plan, action plan for in-depth information. All tonic-clonic seizures. Signs of respiratory distress. Injuries to the head while falling. Sustained seizures or back-to-back seizures, that's status epilepticus. If a student or employee is pregnant, or if they are a known diabetic. Valtoco is a diazepam nasal spray. To administer, hold Valtoco with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the person's nose. Press, call 911. Rectal diastat administration or diazepam administration. Identify and direct someone to call 911. Ensure privacy of the student. Utilize an emergency blanket provided in the kit to cover the student. Gently turn the student on his or her side, clearing the area so the student will not hit anything. Put on non-latex gloves. Remove the medication from the container. Push up with the thumb and pull to remove the protective cap from the syringe tip and make sure the seal pin is removed with the cap. Open the lubricating jelly from the kit and lubricate the rectal tip. Lower the student's clothing. Bend the student's upper leg forward to expose the rectum. Separate the buttocks to expose the rectum. Gently insert the lubricated syringe tip into the rectum. The rim of the syringe should be against the rectal opening. Slowly count to 3. while gently pushing the plunger until it stops. Slowly count to 3 while holding the buttocks together to prevent leakage. Keep the student on their side. Document the time diastat was given and continue to observe the student, making sure there's no issue with breathing. Once EMS arrives, give the diastat that was used. Here are some resources to review additional images for training. This is a new form provided by TEA for seizure management and treatment plan. This goes to the parents who will take it to the provider to complete. This is not in lieu of a nurse's creation of an individualized health plan as required by the state. This will help you create that plan. VNS and magnet use. A VNS should only be done if with MD documentation and used only according to the orders specific to the student. Starting stimulation or the swipe, pass the magnet over pulse generator for about 1 second. Swipe upward, count 1, 2, 3. Put the magnet over the pulse generator. If stimulation stays on, move the magnet around until it stops. The magnet needs to be available to the student at all times and on short notice. Watch style, pager style, or attached to wheelchair. Always record the date and time. Check the boxes that apply on the seizure log. Incident injury reports are filled out anytime 911 is called. Seizure log needs to be completed with every seizure. This information is important for parents, school, and medical professionals to appropriately treat the student and determine the correct type of seizure disorder. Sample log.